Good morning, everyone, and good afternoon, and welcome to this webinar called Clearing the Air, Vaping and Youth in the Caribbean. We are delighted that you have joined us to launch this important report. Today, we are launching a report which was developed in partnership with the Pan American Health Organization. The report is entitled Vaping Among Adolescents and Youth in the Caribbean, Situation, Policy Responses, and Recommended Actions. We have a fantastic panel here with us today to share their experiences and expertise. But before we do that, we would like to share a video with you, which was developed by our Healthy Caribbean Youth arm. And the video really highlights why this is an important issue that we need to tackle with earnest. I'm going to hand over to Danielle to play the video now. Thank you.
I have something to tell you. It's about a toxic friend that young people turn to. I have something to tell you. It's about a toxic friend that young people turn to feel accepted and calm. Few are regulating or trying to regulate this toxic friend, so you can find it anywhere, near schools, at restaurants, in bars. It shapeshifts, so sometimes you can't even recognize it for what it really is: toxic to both our health and the health of planet Earth. You may have heard of this toxic friend. It's the vape. The vape, or the e-cigarette, vape pen, hookah pen, are all electronic nicotine delivery systems, which contain nicotine and other poisonous chemicals. Even electronic non-nicotine delivery systems, which claim not to contain nicotine, are harmful. The thing is, both of these keep a solution which exposes users and non-users to these chemicals. I told you, toxic. What's worse is that the tobacco industry intentionally markets these products to children and young people. And with vaping as high as 17% among 13 to 15-year-olds in the Caribbean, we cannot afford not to address this toxic friend. Read the Healthy Caribbean Coalition's new report to learn more about vape use among youth in the Caribbean.
Thank you, Danielle. Okay, so we have a fantastic panel with us today, as I said earlier, and I'd like to introduce our panelists. Our first panelist is Barbara McGaw. Barbara McGaw is HCC's Tobacco and Control Policy Advisor, and she's also the policy advisor in this area for the Jamaica Coalition for Tobacco Control. Barbara has been with the HCC for over a decade, and we're delighted to have her here with us today to share her wealth of expertise. Our second panelist is Ms. Cheryl Dennis-Wright. Cheryl is the International Consultant on NCDs and Mental Health at PAHO in the Office of the Sub-Regional Program Coordination of the Caribbean. Our next panelist is Mr. Daniel Lopez. He is the Senior Legal Advisor at the Campaign for Tobacco-Free Kids. And finally, we have Ms. Doriel Quinton, who is an HCC-HCY, Healthy Caribbean Youth, Tobacco Control Advocate. So please turn your cameras on. Wonderful. So let's get the discussion going with Barbara. Let's start with the basics, Barbara. Can you tell us what is vaping and how does it differ from tobacco use?
Okay, good morning, everyone. Can you hear me?
We can hear you loud and clear.
Okay, so there's a slight difference. Electronic cigarettes or e-cigarettes are a type of nicotine device that does not burn or use tobacco leaves, but otherwise vaporizes a solution that is inhaled. And the solution contains several chemicals, propylene glycol, others flavoring agents, and may or may not contain nicotine, as well as some toxic chemicals. So the difference between smoking and vaping is that smoking delivers nicotine by burning tobacco, of course, which can cause certain illnesses. And vaping can deliver nicotine by heating a liquid in a originally a much less harmful way. But it's not harmless, and it has been shown to have several side effects. As I said, it was presented as a safer alternative. It's now known that e-cigarettes are undoubtedly harmful. According to the WHO, electronic cigarettes have the potential to normalize smoking in society and attract young people through branding. A little bit of what we saw in the video earlier. Thanks.
Thank you, Barbara. So shifting to PAHO, and Cheryl, can you tell us a bit about the health harms? Elaborate more on what Barbara has just begun to talk about.
Sure. And Barbara did start off. So I just want to pick up from that. So it's definitely, I want to reiterate that it's certainly not harmless. Indeed, there is a growing body of research, which has suggested that in some cases, ends could hinder even cessation. So even though it is being marketed largely as a cessation device, it could certainly do the reverse, which is hinder cessation in some individuals by actually prolonging or increasing addiction to nicotine. So it definitely cannot be recommended as a cessation aid. ENDS contains numerous potential toxic substances, and these will of course vary considerably depending on the product characteristics and the way the device is used. But some of the main substances in the aerosol, for instance, can raise certain health concerns, and these would include the metals, the chromium, the nickel, the lead, and these substances such as formaldehyde and some others, which are a part of the flavoring and the nicotine. So we spoke about the dependence and how, it can cause some kind of prolonged addiction to nicotine. But when you look at asthma, that kind of exposure, it can even make it worse. And chronic obstructive lung disease, some symptoms in regular teenage vapers included headaches, in some research, coughing, insomnia, weakness, chest pain. And certainly there's an increased risk of dual smoking in terms of e-cigarettes and the conventional cigarettes. Some research has also shown that e-cigarette users have, a 30% chance of initiating cigarette smoking. And of course, we have other examples where, the use results in explosions, burns, and some injuries. So I'll stop there, but I'm sure from that you get the picture. It's certainly not harmless.
Thank you, Cheryl. And then we're talking about young people, a particularly vulnerable class of individuals. Barbara, we're starting to see emerging data on the trends amongst youth use of vaping across the Caribbean. Can you share what little data we have, which is indicating that there is a problem that we need to start dealing with?
Okay, so e-cigarette use is increasing in the Caribbean. In some countries, there's actually been a decline in tobacco use and increase in the e-cigarette. Use, of course, the marketing using social media and other methods. The data shows that in all countries except Suriname and among boys in Ghana, e-cigarette use is more commonly among this group of adolescents than cigarette smoking, and is higher in boys than girls. Yes, and I think later we'll talk a little bit about some of the countries that have made inroads in terms of trying to have some regulations around e-cigarettes.
Yeah. So we've heard about the Caribbean situation. We're starting to see that data is showing that there's an increase in e-cigarette use amongst young people. Let's switch to Daniel Lopez and talk about what's happening globally. What are we seeing in terms of trends amongst youth vaping across the world?
Thank you, Meisha. And in similar way as in the Caribbean, as just Barbara noted, a significant number of youth are using electronic cigarettes worldwide, all around the world. The number of youth using cigarettes all around the world, it's quite alarming, to be frankly, and raise serious concerns that e-cigarettes could be an entryway to nicotine addiction and use of conventional cigarettes for some kids and other younger populations. But don't believe me, to provide a better understanding about how dangerous e-cigarette use is, just let me share with you some numbers and some data, some recent data that actually show the amount of younger people actually using these products. The most recent secondary analysis of the latest Global Youth Tobacco Survey data showed how 30 countries out of the 75 countries analyzed, how in those countries the current e-cigarette use was greater than 10% within the populations between younger people between 13 and 15, which is a lot. And actually, according to the same analysis, the highest prevalence of current e-cigarette use in the world, we can find it in Guam with a 35.1%, and the lowest one is in Togo with 1.2%. Here, I'm currently living in the United States, and here in the United States, things aren't any better. According to the National Youth Tobacco Survey released by the US CDC and the FDA, e-cigarettes has been the most commonly used tobacco product among youth since 2014. Actually, in 2022, over 2.5 million youth, including 14.1 of US high schoolers, people going to high school, were current cigarette user, which is it's terrible, if I have to be frank. Here in the States, kids are not just experimenting with e-cigarettes, but also they're using them frequently, leading to an addiction which is very difficult to break. Actually, according to US CDC numbers, in 2022, 46% of high school e-cigarette users reported vaping on 20 or more days per month, which is basically vaping almost every day of the month. And almost 30.1% report daily use of vaping here in the States. Similar trends can be seen in England and Canada. There's a very interesting study recently launched. Happy to share the links to each study I mentioned afterwards in the chat. But this study, performed by the School of Public Health and Science of the University of Waterloo, showed how in England, the current e-cigarette use, in other words, the use of cigarettes within the past 30 days among youth kids from 16 to 19 years old, went from 11% in 2020 to 24% in 2022. It's an increase which is absolutely unbelievable, and that can only be attributed not only to the aggressive marketing technique used by the industry, but also because of the availability of these products in England. Similar thing in Canada. During the same period, the same study showed how the current e-cigarette use went from 13% in 2020 to 16% in 2022, which is quite alarming. And we can see similar numbers in Latin America and the Caribbean, as Barbara just noted. According to the data from the Global Youth Tobacco Survey in Latin America and the Caribbean, we can see the highest prevalence numbers of youth e-cigarette use in Trinidad and Tobago, as actually the report noted, around 17% in 2016, and the lowest in Antigua Barbuda. So the numbers we have seen in the region, in the Caribbean, in Latin America, are quite consistent with the numbers we have seen all around the world, which makes quite harmful and quite worrisome how vaping is actually quite common among younger population. That's why governments should tackle this issue promptly.
Thank you, Daniel. And I think those figures are staggering, and not just the volume, but the rate at which they're increasing amongst youth. And as a parent myself of two young boys, this is a personal issue for me as well. And it brings us to our youth panelist, Doriel. And I think, we heard a bit about in the video, why are young people so attracted to these vapes? Why are the numbers increasing at such a rate? Can you talk to us a bit about why you think these figures are on the rise and what's so attractive to youth?
Sure. Thank you, Maisha. So yes, the increasing youth vaping is a very concerning trend, and there's several factors contributing to this. As Daniel briefly touched upon, the tobacco and vaping industry uses targeted marketing strategies, spending hundreds of millions of dollars each year just to attract young people. They use social media campaigns, influencers, all the different social media platforms. And these tactics, they glamorize vaping and they make it appear trendy, cool, and socially acceptable. And the industry also creates these very enticing flavors, thousands of them. And they use vibrant packaging, which really captures the attention of impressionable young people. And especially during adolescence and youth, we are really susceptible to peer pressure. And there's a desire to fit in, to be accepted, and to also imitate influencers. So with vaping becoming more popular, young people are experimenting more and becoming regular users of e-cigarettes. And there's also the issue of affordability. Many e-cigarettes, the devices and the different pods, they're relatively inexpensive, making them very accessible to young people who might go to local stores or go online and even get vapes from their friends or close family members who are older. And as the WHO Director General, Dr. Tedros, emphasized in his latest remarks at a recent World Health Assembly strategic roundtable, the industry really likes to push the narrative of e-cigarettes and vapes being harm reduction, when really and truly it's just a trap to recruit children at an early age and make them their consumers for life. So with the tobacco industry and the vaping industry together constantly pushing the narrative and the marketing and promotion to increase their consumer base, we're seeing these youth vaping figures globally just rise, and also in the Caribbean.
Thank you, Doriel. Thank you. And I'm sure everyone on this call can share the sentiment. These vapes are widely available on, gas stations and in supermarkets, so very accessible, as you said, to young people. And then that really changes the conversation now to policy. How do we create environments in which access, availability, affordability becomes a barrier rather than an enabler? So we've talked about the response, what the situation is in the region. Let's talk more about the kind of framework around legislation. We have the FCTC, the Framework Convention on Tobacco Control, which has been a powerful tool to regulate tobacco use globally, but it did not predict and it does not contemplate the existence of electronic nicotine delivery systems. So turning to you, Cheryl, we know that you've been working in this area for many years. Can you speak to how the FCTC can be used to address this emerging issue of vaping, especially amongst young people?
Sure. So even though at the time of negotiation of the treaty, vaping, we didn't have, what we are seeing today in terms of the increase in use and so on. Certainly, clearly the thinkers behind the FCTC and certainly those that contributed to it were also forward thinkers, to the extent that Article 2 does provide that in order to better protect human health, parties are encouraged to implement measures beyond those required by the convention and its protocols. And therefore, it even goes further to say nothing in these instruments shall prevent a party from imposing stricter requirements that are consistent with their provisions. And certainly, in terms of their, other legal framework. So apart from Article 2, which gives parties the latitude to go further, this has been something that has been discussed repeatedly at the COPs, the Conference of the Parties to the Convention. And so the discussions in relation to electronic nicotine delivery systems and electronic non-nicotine delivery systems also came up in relation to COP6. And the decision coming out of COP6 is that parties were invited to consider prohibiting or regulating ends, and when I say ends, I'm speaking both nicotine and non-nicotine delivery systems, including as tobacco products, medicinal products, or consumer products, or other categories as appropriate. So we see that outside of the convention, again, these COP decisions, which are decisions that are also binding on the parties, really feature ends. Again, in COP7, we have a decision coming out of COP7 where parties, it says also that parties are invited to consider applying regulatory measures to prohibit or to restrict the manufacture, import, distribution, presentation, sale, and use of ends as appropriate and also in keeping with their national law and public health objectives. Again, when we look at the article which deals with, that's Article 13, the total ban on all forms of advertising, promotion, and sponsorship of tobacco products. If we're treating ends based on these COP decisions as tobacco products, then we can read it within the same light, because the commercialization or the banning the commercialization, my apologies, limiting the possibilities for the possession of novel and emerging tobacco products by minors, as well as restricting, advertising, promotion, and sponsorship are also possible options to consider in keeping with the FCTC to prevent initiation of tobacco use, especially among youth, because we know that, the industry is always seeking to recruit new users, and this being, just an initiation strategy and device. So I'll close by saying that given that the same promotional elements that make ends attractive to adult smokers could make them attractive to children and non-users, effective banning of ends, advertising, promotion, and sponsorship. So if we treat with it in accordance with Article 13 to ban it, then it is encouraged really that really the effective regulation or the effective banning be enforced. And additionally, best practice seems to suggest that the introduction of these measures, including a total ban on tops, which would include ends, and novel products, that would be also best practice. And in the region, we've seen some examples, because in Guyana, for instance, they have a complete ban on taps. By taps, I mean tobacco advertising, promotion, and sponsorship. And there are similar restrictions in place in other legislation, because we know that, for instance, in Jamaica, there are restrictions as it relates to the sale and use of electronic nicotine delivery systems. And that in the bill that is being proposed, it will also cover non-nicotine delivery systems.
Thanks, Cheryl. And you're taking us very nicely into Barbara's question, which brings us back to the report. And the report has summarized and highlighted some Caribbean countries which have started to respond to vaping in their policy and legislation. Barbara, can you share with us some examples of those countries which have started to address this issue, recognizing the problem locally?
Okay, thanks. I just wanted to recap a little bit, which I didn't mention. I know Daniel did mention it, that the range of e-cigarette smoking is as high as 17% in Trinidad and low as 4% in Antigua and Barbuda. However, they are increasing. I just wanted to point here to the importance that the tobacco companies have got it. What they're doing now is that they're buying out the e-cigarette companies because they see the future as e-cigarettes. So some of the big players are buying even small e-cigarette companies, infusing lots of money and then doing their marketing. So the new report does paint a picture on the policy responses. We have several countries that have put measures in place to control e-cigarette use, banning in public places such as Jamaica and I think Barbados, banning imports and regulating generally the use of e-cigarettes. So the countries in terms of a total ban on sales is Suriname, countries who regulate the projects, Barbados, Guyana, Jamaica, St. Lucia. And only two countries, sorry, Barbados and Guyana, look at regulation of use, packaging and labeling and or advertising. But the key that Cheryl mentioned is a dual act. So it's putting it in the legislation in terms of the countries that already have laws or new laws. That is very important. But looking at banning tobacco advertising, promotion, and sponsorship, that is where we really need to go. So you do the banning of imports. But remember, as Daniel said, these little e-cigarettes, they look like a USB. And people can bring them in. In fact, in Jamaica, even though there's a regulation that the Ministry of Health has to give a permit for e-cigarettes because it's seen as a medical thing because of the nicotine, people bring it in a suitcase. They can bring 100 or 1,000 in a suitcase. So we have to look at that. So yes, it's good to ban and to monitor, but the complete ban on the advertising is going to be one of the powerful tools that we do need. Thanks.
Thank you, Barbara. So we've heard a bit about the policy responses in the Caribbean, how Caribbean countries are starting to deal with this issue. Let's switch to the global and hear from Daniel about some policy responses that we're seeing globally and perhaps some best practice examples that we can point to.
Absolutely. And as Cheryl and Barbara mentioned, governments seeking to reduce nicotine addiction have several policy options. They should either ban e-cigarettes entirely or regulate them strictly as medicinal products or using WHO framework convention tobacco control measures. And countries around the world have managed to deal with the e-cigarette consumption issue using one of these different approaches. And the way governments have to approach the issue differs all around the world. So maybe I can provide some examples, global examples of each one of policy option. And we have found and all this information you can find in tobaccocontrolslaw.org, which is the website where we put all this information together. And from our findings, at least 34 countries in the world have already banned the sale of e-cigarettes worldwide. It's not much, but it's something. And among those countries, you could find very big markets for e-cigarettes, as Brazil, for example, also Korea, several countries in Africa, Ethiopia, Gambia, also in Asia, Hong Kong, Taiwan, Thailand. All those countries have decided to deal with the e-cigarette use, absolutely banning the use of e-cigarettes in their own jurisdictions. But also several other countries that they have decided, or they more than decided, they have let e-cigarette they are let e-cigarettes being used in their countries. They have applied the WHO FCT measures in order to actually try to tackle with the e-cigarettes consumption within their borders. And here we have to be very emphatic. If e-cigarettes are available for sale, WHO FCTC measures should be applied to both e-cigarettes and tobacco products. No questions asked about it. WHO FCTC measures should be supplemented also by clear government messages on the risk of e-cigarette use, particularly to youth, which is the topic of today's webinar. And e-cigarettes should only be used by existing adult smokers, and that the best approach for adult smoker is to quit tobacco and nicotine use. So if the country decide to actually allow the sale of these products, should be only allowed to use by adults, but also those the adults allowed to use e-cigarettes should be actually disencouraged to keep using, to try to actually to stop using altogether nicotine and tobacco products. And sadly, we haven't seen a country that we could describe as a good example of the implementation on all overall power measures towards e-cigarettes. I think it's better to try to understand how countries have dealt with this issue. It's go policy by policy. Of course, you have better countries as Canada and Australia, which probably have dealt in a more wholesome way with this issue. But also, we could find several other countries that have very good examples of each of the implementation of each individual policy. For example, in restriction on indoor public use, as Barbara mentioned, Barbados is a very good example. Moldova, Paraguay also has a very strong legislation addressing the use of e-cigarettes in indoor public places. When we talk about health warnings and packaging, Kyrgyzstan and the Republic of Korea have already implemented a very comprehensive set of health warnings targeted to e-cigarettes. When we talk about advertising, promotion, and sponsorship, Brazil, Cote d'Ivoire in Africa, Guyana in the Caribbean, and Moldova have very comprehensive and very broad restrictions banning the advertising, promotion, and sponsorship of e-cigarettes, which is accordingly it fulfills the requirement of the WHO FCTC. Also, when addressing the content and disclosure, these products should have China, Finland, Israel. Israel is a very interesting case that should be looked very closely, because they're being very emphatic, and they have a very strong legislation addressing e-cigarette use. Ireland too have a very good example. It's a very good example of how you should be implementing WHO FCTC measures to e-cigarettes. And finally, I would like to briefly mention countries that have been implemented a very good regime on taxation for e-cigarettes. And I want to mention taxation because, as was mentioned before, one thing that actually increased the use of these products is their affordability. These products are not only available widespread around the world, but also they're fairly cheap in some countries. So implementing a good and a strong taxation regime towards these products could increase their prices and could make them less affordable especially for younger population. And in that regard, Denmark, Kyrgyzstan, and Sweden, they are very good examples of very comprehensive and strong taxation regimes directed to e-cigarettes.
Thank you, Daniel. That was such a helpful answer. I was thinking about your last comment on taxation, and I know back to my own personal experience that, there are kids who are buying these and selling them because they're just so affordable. And we know that young people are extremely price sensitive. So that's really a measure that we do need to look more closely into. So I just wanted to remind everyone watching that we encourage your questions. We will have a question and answer session at the end of the webinar, but please share your questions or comments or experiences in the chat, and we will address them. I wanted to get back to Doriel now. And Doriel, we're talking about the health impacts of vaping, but there are also environmental impacts, other impacts of vaping. Can you share, and just to add before you answer the question, young people have been very much on the forefront of the advocacy in this area. Can you share more of the kind of non-health impacts of vaping?
Certainly, we know that the negative impacts of vaping extend far beyond the immediate health risks. It also poses significant environmental consequences that often go unnoticed, since many people assume that e-cigarettes or vapes are better for the environment than traditional cigarettes. But like many electronic devices, vapes generate e-waste, electronic waste. And some surveys have shown that more than half of vape users just throw them away without properly disposing of the different components, and almost 10% just litter indiscriminately. And the improper disposal of these devices, including the cartridges and batteries, can result in the release of toxic chemicals into the environment, posing risks to ecosystems and ultimately our human health. And most vapes contain metals, which can take many years to decompose, and plastic that never fully decomposes and turns into microplastics, which pollute the environment and pollute our drinking water and food. And additionally, the production of vapes contribute to deforestation, because most vapes derive the nicotine from tobacco plants, which needs land to be cleared for tobacco cultivation. And this cultivation of tobacco leads to habitat loss, and less food can be produced. And this deforestation exacerbates climate change, contributing to global warming. And for small island developing states like us in the Caribbean, that we're highly vulnerable to the impacts of climate change, including rising sea levels and increased frequency of hurricanes and other natural disasters. And this additional environmental damage from vaping further compounds these climate change vulnerabilities that we face. And that is a very pressing concern for young people, because we are the future generation, and any challenges that we face now will be further compounded in the future.
Thank you, Doriel. And that was a really good reminder too of this webinar was also in celebration of World No Tobacco Day. And this year's theme was around growing food, not tobacco. And you just highlighted the link again with vapes and the damage which is done to the environment, especially as it relates to the growth of tobacco. So wrapping up the session now, I wanted to bring it back to Barbara, our policy advisor in this area, to talk about the report and the kind of give us a highlight of the recommendations from the report. The report has a fulsome set of recommendations, but share with us a snapshot of the kind of highlights for us, please, Barbara.
Okay, so we're looking at 3 levels: legislation, policy and regulations, taxation, and earmarking and research. So of course, one of the ways would be to enact or update legislation policies to include ends in addition to the conventional methods of tobacco, and nicotine, utilizing the WHO, FCTC, and the decisions from the COP that Cheryl mentioned earlier. So we've seen, like in Antigua and St. Lucia, the beginning of that. One of the key areas is the public education programs on the dangers of use. And that can be done on a regional level, that can be shared with all countries. I just wanted to point out too, apart from environmental challenges, there have been reports of e-cigarettes exploding because of the batteries. And the fact is sometimes they may use a charger that's not approved, a cheap charger. There was one person whose tongue was blown off because while they had it in their mouth, it exploded. We've seen videos of people having e-cigarette in their pockets and it explodes. So there's that, being that it's an electronic item, there have been challenges there. We need to evaluate the programs to prevent and reduce the use of ENDS among adolescents, integrating them in the programs for adolescents and youth health. So in other words, it has to be integrated into the public health system and even into the health system, substance abuse and prevention and control. I can remember some time ago, we did that work in Jamaica where the intake sheet for some of the hospitals or some of the clinics did not have, do you smoke? How many cigarettes do you smoke? You know, and things like that. So the integration into finding out more about the patients coming in, what is their health status. And we have to enforce the laws on minimum age of purchase. We might want to even increase the age of purchase of cigarettes. That has been discussed as well. We had studies in Jamaica. We were just talking about this yesterday at a No Tobacco Day meeting, where some children in school uniforms were able to purchase vapes at the vape shop or at the gas station or so on. So even in their school uniforms, people are selling to them. So we really need to look at enforcing the minimum age. And scientifically accurate health messages. You know, if we could get there, I mean, that's a stretch, but we need to look at it to have packaging in terms of the e-cigarette. Minimize the health risks by outlawing the use in all indoor public spaces and workplaces. And that is already started in some countries. And ensure that the policy is supported by a simultaneous implementation of tobacco control policy across the board. I think I told earlier about a regional approach, because some of these recommendations can be done regionally and shared. It's not one country has to go ahead and do it. So that's very important. Applying the WHO Empower package, which for some persons don't know, it's to monitor the tobacco use, protect people from tobacco smoke, offer to help quitting, warn against the dangers of tobacco, and enforce the bans on tobacco advertising, and of course, raising taxes. So taxation and earmarking, some sort of fiscal measures need to be looked at to tax these e-cigarettes that's coming in and deter their use, making them more or less affordable. And finally, research, because we talk and we say, okay, we think we know what's going on, but we need to conduct the research on the prevalence, the drivers, and the impact of ENDS use, and have that information. So maybe the next Global Youth Health Survey or household survey, living conditions, there are very, very many surveys to fill the information gap in the Caribbean, including through inclusion of relevant questions in, as I just said, the GYTS and so on. And then publish and widely disseminate the research results, including to policymakers, include and inform the development of an evidence-based policy aligned with tobacco control. The other recommendation I would add is that we really need to include the youth. So the youth should be at every table. Every time we have a consultation, every time we have meetings like Doriel and her team, Danielle and her team, we need to ensure that the youth are involved, because what we found years ago too is that the youth were saying, you know, you're doing all these plans, you're doing all this stuff, but you're not including us. Yes, we are at risk, and we're the new generation of smokers for the, you know, to replace the ones that die. But I don't think enough was done to include youth in any sort of deliberations towards their own health. So I think that's about it from me.
Thank you, Barbara. We have two questions that I'd like us to tackle before we move on to the next session. The first one is, what is the appropriate age restriction? And you just talked about ages, Barbara, and this is Ian Bibby, and they're saying, is it 18 or 21?
Well, I would like 21, but some countries would balk at that. You know, the youth would balk at that, but 21 actually would be good. Again, in yesterday's meeting that we had, one of the doctors was saying that the frontal lobe of the brain does not get fully developed until a particular time, and that using nicotine or tobacco, because it's nicotine when it gets to the brain, does have effect on these receptors. So really, if you could control it until 21, it might be better.
Thanks, Barbara. Does anyone else want to jump in on that?
Yes, Maisha, only to add, I think what just Barbara said, it's on point, but only to add that the age limit restriction should be consistent also with the age limit restriction you have in your legislation for conventional tobacco products. So you don't create a diversion or to the other kind of product because you're creating different levels. So I agree with Barbara, should be 21, but also should be consistent with all the limitations you already have in place in your own countries.
Well, we could also move the tobacco one to 21.
For sure. Yeah, absolutely. Yeah.
So if we're doing one, we do all.
Yes,
Yeah, and ideally align with
the
the alcohol as well.
Exactly.
Yes, definitely.
The other question we have is from Anissa Mentor, and she says, what is the relationship between vaping and development of NCDs amongst adolescents and young adults?
Wow. I don't know if there are any clear relationships at this point, but we do know that heavy use of nicotine can cause high, changes in blood pressure. The connection is not 100% clear, but we know that smoking generally, people can get high blood pressure, they can get, other problems, but it's usually in collaboration with poor diet or alcohol or so on. But I think not enough is known about the effect of e-cigarettes yet. And because it was initially promoted as a cessation aid, the jury is out on that. Because some people say, yes, it's a cessation aid. But again, if you have something that you put in your mouth, you inhale it, smoke comes out at the end. That is not really, from a psychological point of view, allowing you to quit, because then you're doing the same measures. I think it depends on the motivation of the individuals. There are some people who can use it and help quit. There's some who don't, and then we have quite a few research, I know Daniel will know about that, where people start smoking again, or they actually use both. Yeah. So if they may start as an entry gateway using e-cigarettes, but they end up also smoking cigarettes as well.
Thank you, Barbara.
And if we even go back to some of the harms in the reports, we see, for instance, some of what I mentioned earlier about the chronic obstructive lung disease. The fact is, there are still some symptoms which are likened to the use of traditional cigarettes, based on the fact that these chemicals do not belong in your lungs. So you're having an interaction with your lungs and these harmful chemicals, heavy metals, and so on. And where you have that particular exposure, then you're looking at NCDs and other related illnesses.
Thank you, Cheryl. So we have one more question. We've got two questions. The other one we'll get to towards the end, but the next question on civil society and community-based actions leads us nicely into our next session. So thank you, panelists. We're going to regroup after the session that we're going to hear from the Trinidad and Tobago Cancer Society on their community-based response to this issue. And so then I will now invite Dr. Asante LeBlanc, who is the president of the Trinidad and Tobago Cancer Society, to share the exciting new initiative they have, a campaign called Take a Breath, Can't Fool Me campaign, which is aimed at young people in vaping. And Dr. Asante, are you online there? We're really pleased to have, there we go. Hi, Dr. LeBlanc. Lovely to see you. We're going to see your presentation for you. Your connection is not the best. Let me see if we'll get your presentation going. Dr. LeBlanc, your audio, we can't hear you well at all. Is there any way you can maybe try and turn your video off and see if that helps with the bandwidth? Okay, we do apologize for this. What we could do in the time being is play, could we play the campaign materials while, oh, looks like we can see you moving around now. Okay, no, it's just, okay, let's play the campaign videos. while we wait for Dr.
Aisha,
LeBlanc.
can you now?
Yes, I can hear you.
Good morning, everyone. Thank you for having me. Thank you for introducing me. Sorry about the technical difficulties. This is when you try to multitask post-COVID. so do you want to show the two videos first, Maisha?
Let's go ahead and do that as they're already teed up.
Yes, no problem.
Thanks. Unfortunately, we're not hearing the audio, but what we can do is we can share the links for the videos in the chat because they are available on YouTube.
Yeah, that would be good.
Okay, great.
That's not a problem. So,
Okay,
I mean,
thanks. We'll go back to the beginning of the presentation, Dr. LeBlanc, so you can start from there. Let's see. We'll get your presentation up for you.
great. So thank you for having me again. The Trinidad and Tobago Cancer Society is the national voice against cancer in Trinidad and Tobago, and we have been around since 52 years now. While they get the presentation up, I'll just start because I know time is of an essence. So based on what we were seeing and all the stats that you've heard already, the Trinidad and Tobago Cancer Society decided that we had to do something from an NGO standpoint and community standpoint to really raise awareness, not only about smoking, but vaping. So we decided and proposed this campaign to one of our collaborating organizations, in this case, the Scotiabank Foundation. And our objectives were basically to increase awareness about the dangers of smoking and vaping among youth, encourage youth to make informed decisions and choices and resist smoking and vaping temptations, support youth in quitting smoking and vaping, and advocate for stricter regulations on our smoking and vaping products. Next. Right. So we had the Can't Fool Me campaign, Take a Breath, and this is where we had posters, we have the videos, which you will get copies of and you can access via YouTube. And this is because, as I think her name, Barbara said, we need youth to speak to youth. It can't only be adults speaking to youth. And therefore we use a lot of youth in our campaigns. Next. Right. So this is another poster there. Next. Our campaign strategies also include providing evidence-based information, on the deceptive marketing tactics used by tobacco and vaping companies to target the youth, and to organize interactive sessions and discussions that empower the youth to critically evaluate the message that they receive from tobacco and vaping industries. What does this mean? It meant that we went to the grassroots. We are going to the grassroots. We're going to the youth and we're explaining to them, showing them what is happening, explaining what these industries are doing, and so that they can make an informed decision. And we also promote healthy alternatives and activities to help replace smoking and vaping, such as sports, arts, and community engagement. Because obviously there's a reason that the youth are turning to these products apart from manipulation. And therefore we can't just say, don't do it. We also have to give healthy alternatives. Next. These are pictures of some of the symposiums that we've done in a collaboration with Scotiabank Foundation. Amazing. This campaign actually launched in 2019. COVID came, we actually continued it virtually and then relaunched it again in 2023, where we're going back in person. So these are just pictures of sessions that we've done with many schools. And on Monday, I'm actually going to Tobago, our sister isle, to do another one. Next. We needed to raise awareness and advocate about the need for stronger regulations and policies on marketing, sales, and access to smoking and vaping products. What does this mean? So we were very, very instrumental in enforcing the Tobacco Control Act in 2009 in Trinidad and Tobago, and it covered a vast range of everything from labeling, who you can sell to, and everything. But guess what? There was a loophole with the ends. And therefore, I was so happy to hear about the FCTC and the COP6, because then we really need to continuously reinforce the powers that be to improve our legislation so that it's much tighter. Next, then lo and behold, WITCO, West Indian Tobacco Control Organization, thought it was very wise to come out and say that they not only had increased profits, but we're now going into the vaping production industry, and then decided to give erroneous information saying that vaping is 95% safer than smoking. So we immediately, and I won't say reacted, but reiterated what we've been saying forever, and then brought out this newspaper article in celebration of World No Tobacco Day, but also as a continuous reminder to everyone, including the youths, about the lies that the industry can tell. Next. Not only that, thanks to Scotiabank Foundation as well and Guardian Media Limited, we were able to do a panel discussion where we were talking about the truth about tobacco and cancer and vaping. And this was in celebration of World No Tobacco Day 2023, where the theme was grow food, not tobacco. And here we had a panelist of doctors, including Dr. For smoking cessation. We had a PAHO rep, we had Dr. Capildeo, an oncologist, and we had a survivor, a cancer survivor, and pediatrician. A very stimulating panel discussion, and we can also provide that on YouTube for you. But this allowed us as well to further educate and bring to the awareness and to the forefront the lies, the manipulation, and the truth about vaping and tobacco use. Next. The Trinidad and Tobago Cancer Society has been and will continue to be a strong anti-tobacco advocate. We've been very instrumental, as I told you, in the anti-tobacco bill of 2009, and we're not giving up. We're committed to continue to effect policy change by agitating, advocating, and making as much noise as possible so that we can have vaping and everything else included in this bill, to ensure that there are no loopholes, to ensure that the policies are enforced at all levels, and to ensure that it benefits the young population of Trinidad and Tobago, and dare I say the region, CARICOM, and therefore worldwide. We're not stopping and will not stop, and we are so grateful to be included in this conversation and are willing to work with all stakeholders involved. Thank you so much for your time and attention.
Thank you, Dr. LeBlanc. I mean, we are honored to have had you present here today. I think when we came across your campaign, we were so impressed because it's one of the few campaigns that we've seen led by civil society in partnership with a private sector organization, really taking on this issue, which we've heard directly and indirectly from government representatives and partners across the region, which is a rising issue and one which they're very concerned about. And they're grappling with legislation, and where there is legislation, they're grappling with enforcement. So we really need, as we keep on saying broadly with NCDs, is this whole of society approach, and civil society has played a really tremendous role clearly here in Trinidad, bringing this issue to the fore, creating public dialogue, and really standing up to industry, which is, you know, a force, and it's a real risk in of itself. So we congratulate you, and we learn from you, and hopefully this can create a movement across the region in which other civil society organizations, especially cancer organizations, are taking this on. I know Barbara was also very excited to see the work that you are doing. So I'm going to invite all of the panelists to turn their cameras on again, and we've got about 5 minutes left. We'll have a question and answer. I'm going to start with a comment that was in the Q&A. It was around Jamaica. In the Ministry of Health Youth Forum in Jamaica, youth said that they've been targeted with flavors of e-cigarettes in pretty packages. And how concerned are we? And I'm going to turn this question to Daniel and then ask Doriel to comment on as well. So Daniel?
Thank you, Maisha. And I think my first and short reaction should say it's very worrisome. Flavored products are driving the youth. We talked before about how the use of e-cigarette by younger populations it's been pushed by the industry using very aggressive advertising techniques, but also the content of the products have been one of a very strong driving force to push for the use from the industry. Actually, if you allow me, here in the United States, the CDC have said that 85% of youth e-cigarette users use flavored products. And when they are asked why they started to use products, the younger population say it's because of the flavors. Here in the States, you can see, and all around the world, to be honest, flavors as fruit, candy, desserts, and very attractive named flavors that actually they are designed to hook younger populations and the use of these products. So here in the States, you can see how kids have shifted dramatically to not only to disposable products, but also to menthol and flavored products. So that's why the only way to actually to tackle this issue and to end to end the use of flavored products, it's banning. It's banning flavored e-cigarettes, and some countries in the world have already taken some steps towards the end. For example, I already mentioned China as one country banning the use of flavored e-cigarettes for the domestic market. I think that's a very important distinction for the domestic market. But Finland, Lithuania, actually Ukraine. I want to highlight here the marvelous job that Ukrainian government and Ukrainian civil society they are doing, even though they're facing, they're going through a very horrible situation there. They're even during these very dire times, they have passed a law banning flavored products, flavored e-cigarettes. So I think coming back to the question, it's like it's very worrisome seeing how flavored products are being used by the industry as to spear the use of their products, but there's countries actually taking some actions against it, and I think that's the correct path to actually to tackle the issue.
Thank you, Daniel. And over to Doriel, and then we'll get to you, Barbara. Doriel, you and Barbara co-led a focus group meeting with young people, and this issue came up. So we do know, this is not only in Jamaica, we're hearing about this across the region. What's your thoughts on this?
Well, I 100% agree with Daniel. The flavors are a big issue. I've seen reports of there being like 15,000 different types of flavors, all these combinations, banana, mango smash, peppermint. And I think this also poses a very interesting issue with secondhand vape smoke. I think a lot of people generally don't like the smell of cigarettes. So I think young people might be a little not really concerned if someone vapes around them because it doesn't smell unpleasant, but they're still exposed to the nicotine as well as the other particulates that are in the vape smoke. And also the marketing, the aggressive, like the packaging and using influencers like on TikTok, Instagram. And sometimes these influencers don't even disclose that it's an ad. They just make it seem like, yeah, this is my favorite vape, and young people will bite into that. So I think that's something that really needs to be looked into, the aggressive marketing tactics.
Thanks, Doriel. And over to you, Barbara, which must be like deja vu, all of this for you. Tobacco all over again.
Oh, yes. I just wanted to make 2 points. WITCO's plan to go into e-cigarettes has severe implications for the entire Caribbean. For those of you who don't know, WITCO distributes cigarettes to the entire Caribbean. In fact, Jamaica was the place where the cigarettes were made. After some successive tax increases, Carreras moved their operations to Trinidad. And then WITCO took over the massive WITCO, is the West Indian Tobacco Company. So with the plans that WITCO has to go into e-cigarettes, we need to be aware that that is the whole Caribbean they're looking at. And the current head of WITCO in Trinidad was in Jamaica. He was the managing director in Jamaica for some years and then moved back to Trinidad. The second point of concern is the flavors and the flavoring has a severe impact because there are some of the e-cigarettes that have a capsule. So they're not pre-authorized. You have some that are pre-authorized. You actually have some where you can put in your own thing in the capsule. And this is where you talk about marijuana use as well as nicotine, as well as the flavors. That has its own challenges because even the amount of nicotine that would be in one of these capsules is probably equal to 10 or 12 cigarettes. There's been studies that shown that because you have in the e-cigarette, you can buy different levels of nicotine, 5 milligram, 10 milligram, and then you put it in the capsules. But you can also make your own where they mix it with other products. So we need to be aware of that. So the flavorings and the options have assisted in people being more creative in how they use e-cigarettes. So it's just something I wanted to point out.
I think that's a very important point, Barbara, and an important point to end on. So we have reached the end of the webinar. I'd like to close by asking everyone to think of, a takeaway that you'd like the audience to walk away with. We have a great turnout today. Almost 100 people joined us. We had over 100 registered. So we're really delighted that you've all joined us. What's your key takeaway message for the audience as we collectively move forward across the region, hopefully getting governments to prioritize this issue and then take action with policy and legislation? What do you want the audience and policymakers listening to take away from this webinar? And I'll start with Cheryl.
Thanks, Maisha. So for the audience, just think about your health and the future generation. We know that the industry is into recruiting new users. And if this is a gateway product, then it's treating our children, it's treating non-users as the replacement for those who are already hooked on nicotine. For the governments and policymakers, the takeaway is to just take another step to implement 2 stringent measures: a total ban on all forms of advertising, promotion and sponsorship of these products, including using, as Dorial mentioned, the social media influencers, and also the best buys as it relates to taxation to make these less accessible.
Thank you, Cheryl. And over to Daniel.
Thank you. I think the main message I would like to deliver is that as the data we share today, it's like we're currently facing a crisis on youth addiction, fueled by these kid-friendly flavors and which they include huge amounts of nicotine and the aggressive techniques of the industry to try to hook a new generation of consumers. The number of youth population using e-cigarettes all around the world, it's just alarming, and governments must tackle the issue promptly. And the good news is that there's several very good examples all around the world that could be looked at to try to see how other countries, other governments are actually addressing the issue. And that's a good news. Like we don't have to invent the wheel. We can actually feed from other experiences worldwide. Sharing knowledge is key to tackle this issue, and we can actually go for it and try to discuss it. And again, reports as the one launched today are a very helpful resource to help moving in that direction. So the highest of praises for HCC and the report.
Thank you, Daniel, who's also a contributor to the report. Everyone on this panel has contributed. Dr. LeBlanc, over to you.
Wow. So I think my takeaway to the audience is obviously don't smoke, don't vape. But most importantly, we've come out of a huge pandemic and health crisis. And I think we have to understand that our health is going to become, our illness by smoking and vaping is going to become a profit for people such as Whitco. So they're going to be enjoying their profits and you're going to be dead, plain and simple. For policymakers, I would like to say, it's not like we're starting from ground zero. We had all COP, 6 COP, whatever COP, 5 COP, 4, we have FCTC, we have all these documents. We do all these meetings. So it's time to put our pedal to the metal and do what we need to do. We need to just effect what we've discussed and what we've agreed on. And that's all. I mean, just do what you have to do because we're all affected. This is not a one country situation anymore. And I mean, just looking at our situation in New York, looking at our temperatures in the Caribbean, that's enough for us to make a change. And it's really, the time is now to everyone. Thank you very much.
The time is now. Thank you, Dr. LeBlanc. And over to Barbara.
Okay, thanks everyone. My takeaway is everybody's messages. All the things I had to say were taken, but the key is we need to protect our children's health. We need to protect our youth because we won't be around. And as you know, 50% of the smokers will die from their illness. We need to put whatever it is in place to protect our youth.
Thank you, Barbara. And what a fitting way to hand over to Dorial. The youth who are most affected by this, our future generation. Dorial, close us out, please. Thank you.
Sure. I really want everyone to take away that we have an urgent need for comprehensive regulation, addressing aggressive marketing tactics, the affordability, social media influence, and gaps in the regulation that contribute to the accessibility and the attractiveness of vaping. And resonating with Barbara, we need to protect the youth and involve youth in these discussions. That should be our top priority.
Thank you all, and a special thank you to Doriel, who organized this entire webinar. Doriel came to us a few years ago as a young graduate from her master's program, said she was passionate about tobacco control, and we've been trying to find opportunities for her to shine, and she certainly shone today. Thank you all of the panelists for your contribution to this report. We are really looking forward to sharing it with you. It will be on our website on Monday, and we will send it by email to everyone. Congratulations again to the team in Trinidad. Dr. LeBlanc, we are really proud of this campaign and looking forward to continuing to shine a light on it. PAHO, thank you for your continuing support, and TFK for guiding us with the global work that you are doing. From all of those at HCC, thank you for joining us today. Have a wonderful day and enjoy your weekend.